We want to improve her outcome. And the good news is I do have a suggestion.
Okay, excellent.
The bad news is it comes with lots of baggage. So I would, if you were here and you were my patient, you are my patient,
Yeah.
but I would be putting on high dose steroids for three months minimum.
Yeah.
Now, this is always fraught. Always, not sometimes. So, when we tell you about drugs, we tell you about side effects in some cases. This is in all cases.
Yeah.
And, when we talk about drugs, side effects are 10%, this is 100%. So they all put on weight.
Yeah.
And the little pumpkins, like she is, tend to blow up more than the little skinny ones. The skinny ones, their faces might plump up, but the pumpkins, the solid ones, tend to get more plump. So she would put on weight. It does have loads of side effects. So the side effects are always really scary, and you might want to run away and not think about it. If it was my child, I would do it.
Yeah.
But I always say when I do this, it's a contract between you and your doctors, and in this case it's me as well, but I'm conscious that I'm a long way away. And if something goes wrong, we need to take that responsibility together. I don't think that, I don't want you to go in there blind. I want you to go in there very open. Now, why would I do it? I would do it because you might improve a long-term outcome. She's never going to be normal intellectually, you know that.
We know that, yeah.
But what you want is to reverse this regression and try and get her back to where she was.
Yeah.
Now, is that worth the side effects? Yes, but the side effects have a mortality risk with them, so it's not nothing. And so I make it scary because I think it is a bit scary. But I have got, my guess is I've probably had between 10 and 20 patients, because I'm getting a bit old now, so many patients under the water. But I think that basically I've had long-term steroids on, and they have, I think none of their parents are sorry they did it, but they have not generally been able to get off the drugs at 3 months.
Yeah.
So while I'm selling it to you that it's a 3-month trial, I have got one little girl who's was on it for 8 years. You could talk to her mum if you wanted.
Yeah.
She's actually probably the most similar.
Okay.
She hasn't got dysmorphology and she hasn't got Rubinstein-Tabby, but she's maybe a bit worse actually. She's a very good mum, and I'm sure she'd be happy to talk to you. So we got her off it after 8 years, and then it was really interesting. I saw her this week actually, and she's 14 now. So is it 8 years? It probably might be 6, 7 years. I might be over calling it a tiny bit. And she came out with another immune condition with red lumps earlier this year, a few months ago. And the treatment for that is steroids, and the rheumatologist put her onto steroids for a week or two, for a month or 2 months for this thing.
Yeah.
And her cognition improved. So I finally got her off the steroids after 6 to 8 years, can't remember. She came off them for a year or something. She went on steroids for something else and she improved again.
Yeah.
So it just shows you, and in fact we've now left her on it, which is why I've seen her, but on a very low dose. So let me tell you about the side effects. The side effects, the one they all get is weight gain.
Yep.
The rest they don't all get. So you have a risk of hypertension. Now, of all my patients, this little girl is the only one that's ever had hypertension, but she's needed treatment for it and she's back on it now.
Yeah.
You can have cataracts. The only one that I've ever had with cataracts is this same little girl, and she has had to have cataracts removed, so that's not small fry.
Yep.
You can have change in mood, so you can have depression, or you can have euphoria, which is the opposite, where you get as high as a kite. I haven't really seen that with my kids. You can have bone health changes, and that's an issue.
Yeah.
That you get thinning of the bones, which long term can be a problem. So I would want Dr. Naidu to do bone mineral density studies and to monitor that. Yeah. And you do that 6 monthly to 12 monthly. Now, it may well be that her bone health isn't normal to start with. Have you ever done bone mineral density?
No.
Okay, well, at least you have more sun up there than we do.
Yeah.
But so the bone health is something. Diabetes can happen. Never really had it. I'm just trying to think of this little girl, the most severe one that ever actually got diabetes. I don't think she did. She didn't, but that's a theoretical one. Mm-hmm. And now I'm going to ask Lauren, what else? What other steroids? You can get muscle weakness. Never had that. And one of the interesting things about I'm going to call this thing ECSWS now because it's easier, but one of them is that sometimes you lose motor function, and this little girl that's so severe that I was just telling you about, she's my most severe. She's actually lost her one side function at times and got better with the steroids.
Yeah.
So how have I rationalised the steroids? In my head I've rationalised that it's a life-threatening disorder, and therefore you're improving long-term outcome. But the risk is that, I know what I haven't told you about, infection and stroke. They're both side effects of steroids, and they can both kill you. Now, thankfully, I've never had that with any of my kids, but, I'd hate you to go into that not knowing it, because if it happens, you have to be able to sleep with whatever happens, and I have to as well, and we have to know that it's the right thing.